Inability of the heart to pump enough blood to the body. It's an important cause of disease as well as death, both in children and adults. As the heart failure progresses, whatever medicines or procedures or surgery, what we can do to maintain stable health doesn't work. So then what we call as advanced heart failure, which progresses to end-stage heart failure. One of the key treatments for end-stage heart failure is heart transplant, which can be life-saving. Generally, once we reach the stage of advanced or end-stage heart failure, the chances of death within 6 months is almost 50%. So generally, if you follow a set of patients over 1 to 1.5 years, most of them would have been died despite all the treatments. So unless you change the course of the treatment, we can't alter the disease. So the usual causes for heart failure is the problem with the heart muscle, what we call as cardiomyopathy. The other cause is congenital heart disease, where most of the treatments can be successful with repair of the congenital heart disease. Over the last 20 to 30 years in India, there have been hundreds of thousands of cardiac surgeries are done in children to repair all the defects. A small portion of them continue to have the problem what we call heart failure, where the pump is weak. We are unable to treat this disease unless we do a transplant, and that is where the decision making comes in. So who needs a transplant? Again, we just talked about any disease where you progress to end-stage heart failure, you would need a transplant. And what is the procedure involved? Dr. Julius will go over the basic details of how a transplant will be done. Now, what should I expect after a heart transplant? Heart transplant is not a permanent cure. You have to be on medicines lifelong. You have to come to the doctor visits, you have to get tests done, but the frequency and severity of follow-up and many things get better and lesser over time. So within the first year, if you take good care of your health, generally you can live long time.
Ability, the infrastructure and the personnel which is required to take care of end-stage heart failure right from the point of diagnosis, evaluation and specialized tests, right heart catheterization, use devices. Sometimes they may need temporary support with mechanical devices. All these under one roof. We also have these available in many of our other units around the country. What is most important in a heart failure and transplant program is the skill and knowledge which is required by the people who are involved in the program. I am very lucky to have a team with very good knowledge and training.
It was on the 3rd of December 1967 when Professor Christian Barnard did the very first heart transplant. Now, apart from being a milestone for all of us, the important thing was that a heart transplant was made possible. This set the stage for all that has been achieved till now. Every organization that goes through the transplant process acknowledges that this was an event that benchmarked the beginning of the heart transplant program. Of course, it was done in the Groote Hospital, Cape Town in South Africa, and the recipient lived for almost 18 days before he succumbed due to pneumonia. This is a throwback on the pictures, Christian Barnard, and then the donor as well as the recipient. Coming to our own home here in India, first of all, the Transplantation of Human Organs Bill was approved by the President of India on the 7th of July 1994. So this is a landmark for all of us because this was the first time that an organ transplant was made possible by a legislation. After that, it was quickly followed up by Professor Venugopal, who did the first transplant in India on the 3rd of August 1994. So this again benchmarked that a transplant was possible in our country, in our own home.
It was a very difficult time for us when we came to know that our child had this kind of issue, and I know no parents want to hurt this thing. But nothing is in our hand. Luckily, we got such a group of people where we came to know that in Narayana Institute, we have a hope that our child may going to survive. So the end result is in front of you all, that the operation got successful and our child is with us.
My name is Dr. Yan Shetty. I work in Narayana Health in Hosur Road. I am the director for the Paediatric intensive care. This baby was admitted under us even before the transplant, when the baby was waiting for a heart. Once we got the news, we got him ready, and after the operation, generally after a heart transplant, our role in the intensive care is to make sure that we treat the patient. We generally, after a heart transplant, the heart goes weak because there is an ischemic time, and during that time we support the heart. We leave the baby in the ventilator, and also after the heart transplant we'll have to suppress their immune system by immunosuppressive drugs. That makes them more prone to infections. So we have to take good care, and once the heart gets back its function, we slowly have to take the baby out of the ventilator and take out the medications which are supporting the heart, slowly transit the baby out of the ICU. These are very challenging even in an adult. So for us it was a unique challenge. Even though we look after the highest number of children after heart surgery, this is a little different after heart transplant, and we knew the gravity of the situation because this heart has been donated by another child, and it is, for us, a heart is very precious, and it's not easy to get a heart and transplant a heart on a 1-year-old. So it was very challenging for the whole team. I would like to specially mention that this wouldn't have been possible without the nurses, the respiratory therapist, the physiotherapist, the dietitians, the pharmacist, and there are many more other support staff which help us in getting this child through. It was challenging. It's not something that we don't do day to day, but it is a little unique.
Thank you, sir.